Mrs. Gifty Ando Apia. This is the Pulse. Please be my guest. Let's go through the details of those stories now. Doctors treating COVID-19 patients in Ghana say they are worried about the severity of recent cases on their hands. The number of severe coronavirus cases is on a sharp rise, many in critical condition and needing assistance before they can breathe. Today, the JoyNews Health Desk takes you to Ghana East Hospital, where COVID-19 patients are battling for their lives. Matilda Gavi has that report. So this is the high dependency unit at the Ghana East Hospital. In this room, there are 4 critically ill COVID-19 patients needing the care and assistance of critical nurses who are going every length, who are doing all it takes to make sure these patients are stable and brought out of this unit. So we'll be monitoring what the nurses will be doing and give you all that you need to know for you to have a better understanding, for you to appreciate the message of COVID-19 that has been preached over the months. Inside the high dependency unit of the Ghana East Hospital, very critically ill COVID-19 patients are being attended to. 4 patients are battling for a second chance to live. Every beep from these ventilators speaks volume. Some sick person living on, or a life gradually slipping out of time. So what exactly are you doing?
It's an oxygen, and then the system has gone down. Okay. So I'm just maintaining it, the level, so that he can take it.
So that he can become stable?
Yeah. So when they bring the other cylinder, then we can put him on it. Okay. The system, this is a central oxygen system. Okay. Yeah. Okay. And the system is down, so you can see here. It's written low oxygen flow. So they are now working on it for the system to respond, and then it will be normal.
Okay, all right. But at this point, he's getting what he needs.
Yeah. For now, so we are bringing a mobile oxygen. Okay. Yeah, for him to be on it for now. Okay.
Linda, not her real name, is no longer in the ICU. She's recovering from COVID-19 under very strict supervision. Before she tested positive, she was very mindful of adhering to the safety protocols until she let her guard down at a family gathering.
Well, thank you.
How long have you been here?
If I tell you I can't count my days, I'm lying. But just about, I think, almost a week.
Almost a week?
Yes.
But generally, how is the body doing and everything?
Super.
Super.
Yeah.
You're getting better. How did it happen? Were you not wearing your mask?
At all. It's family. And I think we take it for granted. So I used to call myself the COVID police until the police caught me.
You were COVID police in your family?
My family.
And you got it? What happened? Did you stop wearing your mask?
I took it for granted one day.
One day? Where did you go?
Just family.
Oh.
Family, yes.
And it happened to you?
Yes, it did.
What message can you tell people out there looking at the experience you are still going through?
What I'm going through, I was very serious about it. Everywhere I went, I was campaigning for it. But one day, I just lost guard myself, and then it happened. So let's just be careful. It doesn't matter who or where you are.
Grandma Ife stayed away from all public places, stayed home with the family, but got infected.
How are you feeling now?
I'm feeling much better than when I came.
When did you come in?
Last Monday.
Last Sunday.
Last Monday. Last week.
Monday. Okay. And what brought you here? Were you not observing the protocols like they were telling all of us?
My grandchildren were for a party.
Oh.
And then after the party, they swam. So when they came to me, I think 2 days later, the big granddaughter was having some symptoms. By then, I didn't know the symptom. My hers was like a runny nose. Then later on, I saw that she was getting temperature. So we rushed her to the pharmacy if it's malaria. Then the pharmacist told us that it's not, but he just gave us some first aid. But when we came on the following day, I said, no, let's go to Nogochi. So the little one was coming closer to me. So I think after 4 days, I also started feeling a bit throat itching. But I didn't take it serious. I just went to do my concoction and I drank and it was over. Then 3 days later, that this thing will hit me.
Wow.
I kept vomiting. I was not coughing too.
Oh.
I kept vomiting till I was vomiting green. And then my son said, no, Mommy, you have got COVID. Let's go to district hospital.
So what happened to your grandchildren? Where are they?
They went to Nogochi and they were all tested positive. So they have their own hospital they go to. Okay. But now they are fine. Oh, okay. They are at home.
What would you tell people out there? You said you were not going out. You were not going for parties. You were even a caterer. You don't go out there to do your business.
I wouldn't commit myself because I saw some things in London. Caterers who got trouble, even though they worked out of their hearts. People got COVID from them because I'm not the only one who is going to do the cooking. Definitely I will call people, and if the person don't tell you the truth and you involve, then you get trouble. So I won't do catering right now till this thing comes down.
What advice would you give people out there?
For me, I advise them that, my advice to them is that they should be very cautious about when they are catering for people. If you know you are not safe, especially the staffs that you are working with, you must make sure they go for a test before you let them get themselves involved in the cooking. Me, I retired about 4 years ago, so I'm just relaxing small. But those who are not retired, my only piece of advice to them is they should make sure they go for the test and they are cleared. Then you know you are safe.
Other patients who are now out of danger and recovering from the virus are cautioning the public to adhere to the safety protocols.
Well, the sickness makes you very weak, very, very weak, and it's not comfortable at all. Okay, that's what I would say. It's not a comfortable disease. Yeah.
What should people out there, what should they do? What should they do so they don't find themselves in this situation?
People should take the warning seriously. People should observe the protocols. The disease is here. It is not a fake.
Did you see this coming to yourself? Did you by any means know how this happened to you?
I thought I was even observing the protocols, but here I am. So people to really take it serious. I think that we should not take things for granted. The effect on you, the person sick, your family, your friends, is too much. And I want to advise everybody out there, please, no need for machoism. Obey the protocols. Obey the protocols. You will be very much helped if you observed the protocols.
How long have you been here?
I think I've been here for almost a week now.
How did it happen? Did you see this coming?
Surprisingly, I've been very careful as to how to manage my affairs on this COVID issue. But sometimes you are constrained. You find yourself in a lot of activities you cannot run away from. And so before I arrived, Jack, you have it. I was anticipating that the COVID was going down after some time, especially getting to the Christmas time when we had the statistics. But of late, we don't get the statistics. So people think that COVID is still going down, but that's not the situation. Within the shortest possible time, we've seen a lot of people getting into it in their workplaces and all over the country. For me, I think that is a call on us as a country to sit up immediately once we are going to open schools in the next few weeks, months, whatever, that the government decides on. My life is in jeopardy, and the jobs places will have to start with working at home and making sure that places are not congested, because then we will not be able to fight the menace the way we have to. The COVID is real. It's painful to go through it, and I don't expect people to come into that situation that we find ourselves. So let us follow the due processes and the protocols that is ahead to the COVID and make sure that we have a better country running. If we are not able to sit up and we jeopardize our life into the next few months, there's a possibility that there could be lockout, and the consequence will be disastrous for the country and the economy as a whole. Ghana has done immensely, especially taking care of this COVID issue. For the first time in my life that I've seen with my eyes, the structures that have been put in place and the way the nurses and the doctors have enough time for COVID patients, you will be marveled. They spend all their time, all their resources, all their strength, making sure that everybody who comes here is better off. The surprising part of it is that when you are here, you don't pay a dime, not even the food that you eat. You eat 3 times a day, medication and everything is free. And this has been borne by the government. It shows the kind of money that has been sunk in, which otherwise would have been used for other developmental projects to help the country. Let us be cautious of that, though we have this facility, not to stretch this facility, and so that the little money that the government would have used for other sources would have also been, redirected here again. But I think on the whole, the government have done well.
A total of 62 COVID-19 patients are receiving care here, but the severity of their condition is a source of concern to health workers. Dr. Ebenezer Ojo-Mensah is the medical superintendent at the Ga East Hospital.
Well, Ga East has been seeing COVID, or been involved in COVID management since March 2020.
Okay.
Yes, we've seen almost 1,008, 1,009 patients so far. But we've noticed an increase in the number of ill patients since the beginning of this year, 2021. Our emergency room has been inundated with very ill patients.
Okay.
We've seen a significant increase in the number of admissions. Shall I say probably 2-3-fold increase in the number of ill patients we are admitting as compared to the first surge, if I should put it that way.
Okay, so it means, so last year, how many cases were you seeing on daily basis? And when you compare that figure to this year, within this period, how many cases are we seeing now?
Towards the end of year last year, we were doing on average 2-3 ill patients a day. Currently, we're doing about on average 10 ill patients a day, and we still have a backlog. I must confess that over the past 2-3 days, we have admitted very, very few patients because our emergency room is full and we cannot admit further any new patients. So we've had to direct them to other hospitals.
Wow.
For care.
So at the moment, as we speak now, Ghana East is not accepting new cases?
We reduced the intake because we want to make sure those on admission get the best of care and recover before we take in any further new patients. So luckily, the infectious disease center is up and running now. Okay. So most of our new patients have been diverted to the infectious disease center.
Okay, so the cases that are coming in, the symptoms they are manifesting, what are they generally?
The major symptom we have is cough and difficulty breathing. Okay. And that alone is a basis for admission. Okay. Let's remember COVID-19 is a respiratory problem. The virus attacks the lungs, destroys the lungs, and makes breathing difficult. Okay. Then you cold, become septic, where the virus gets into the blood and then causes a severe infection, which could lead to death, could lead to destruction of a lot of your organs. And that's what we're seeing now. That comes again with increased mortality. Wow. As has been said worldwide, for this year, there is a new variant, and that variant seems to be, when it affects you, it's more severe, causes a more severe infection. And because it causes a more severe infection, it's more difficult to deal with. And unfortunately, lives are being lost. And we believe that the increased mortality is most likely because of the new variant.
Wow. And are we seeing more of such here?
Yes, if you compare the severity of illness we're seeing now to what we had in the past, to what we had in 2020, we think more people are ill now than last year, and the severity of the illness has increased compared to what we were seeing last year. And this can't be due to chance. So if a new variant
what exactly is accounting for what we are seeing now? You said in the last 2 to 3 weeks. What is accounting for this rise or these changes we are seeing, the severity you're talking about?
Well, this coincides with the worldwide pattern of increased severity of COVID-19 across the world. If you look at most countries, UK, Germany, etc., they are more or less closing up now because they have more ill patients on admission. If you listen to international news, and that's exactly what we are experiencing now. And it has been acknowledged that the new variant is in country, including the, and these are known to cause more severe disease. So since we've had quite a few of our compatriots coming over the holidays, we believe that one way or the other, the new variant has found itself into the country and could be contributing to the severity of the disease we are currently seeing. That does not mean the old variant is not there. It's still there. It's still causing illness and disease. But when you compare the severity now to what we had earlier, we believe something has changed. Yes.
So there are people who are talking about this new variant and some of the symptoms it's showing up with. Some are saying swelling, rashes. Some of the cases, the person didn't show the regular symptoms that we know of COVID, like the chest and then the cough and all that. They are showing different signs. Are we by chance seeing any of these similar things here too as well?
Well, for us in the hospital, most of our clients who come to us are ill. And usually it's from respiratory conditions.
Okay. Doc, there's this perception out there that I would like you to speak directly to. We've been out there speaking to people, members of the public, trying to find out from them, because a lot of people are saying that it's because we've laxed the protocols. That's why we are seeing these cases.
Well, I do not believe that COVID is just a disease of the rich, or it's just the rich that are dying. We've seen deaths. I have a morgue, and I know that our bodies are brought in, day out, and they are not only for rich people. Yes, the rich may be the one who probably get tested and get confirmed, for which reason we can say that, well, he or she died from COVID. Whereas the middle class or lower class may not necessarily go test, but they may be ill, find themselves in one hospital or the other, lose their lives, and probably end up being classified as non-COVID because they haven't been tested. COVID is out there, it's killing everybody, irrespective of your socioeconomic background. Yes, and the middle class, higher class tend to have more comorbidities, diabetes, hypertension, etc. So it's quite account for why we may be seeing more of COVID in more of them ill than in the lower class. It doesn't mean they don't have it, probably because they do not have comorbidities. They tend to have a milder form of the illness, whereas those with comorbidities may be ending up with severe form of the illness. But it's no respect of class.
So what are we not doing right? What are we not doing right, and what must we do to possibly bring down the cases that you have had to deal with in the past few weeks?
I believe we still need to go back to the basics, the infection prevention protocols. I admit that during the festive season we lacked a bit in adherence to protocols.
During the festive season?
During the festive season we lacked a bit, and it has continued till now, where you can now enter a shop without any hand hygiene being practiced. You see a few people entering shops even without face masks, and they are allowed in. That was not possible. That was not allowed. We need to go back to that. There is primarily a respiratory illness spread through droplets. If I have my face mask on and you have your face mask on, the likelihood of spreading the infection or contracting it from each other is very minimal. So basic, if you need to get in close contact with anyone, just make sure you have your face mask on. The other person has a face mask on, and we will be protected. Of course, hand hygiene is still important. Wash your hands as often as possible, and then use your hand sanitizers if need be. Those basic rules will ensure we reduce. We will not eliminate it, but we can reduce the number of people infected.
Any other thing you'd want to add?
Let me just add that the healthcare workers are doing their best in the fight against COVID, with, of course, support from government. A lot of health workers have been infected with COVID, and that has taken them out of their service delivery points. If you do not practice infection prevention control measures, you put health workers at risk. You reduce the number of persons available to take care of you, to take care of your relatives. Support the health service to also take care of you.
Dr. Ebenezer Ojo-Mensah, he's the medical superintendent here at the Ga East facility, attending to COVID patients here. If for any reason you have doubted the COVID-19 messages that have been out there, if for any reason you have let your guard down, you have ignored the safety protocols that have been outlined by doctors on the front line, the visuals from this room alone should tell you something. See how critically ill COVID-19 patients are battling for their lives. See how frontline health workers